Hello and welcome to the Headache Doctor podcast. I'm Dr. Taves, joined by Dr. Stoerzbach. And as always, it's our mission to educate and empower everyone with headaches and migraines to break free from a life of fear and dependence and thrive in everything you do. On today's podcast, we're going to get real practical. I think this will be a favorite for the listeners out there because we get asked all the time about home tools, what people can do at home to help mitigate reduce the level of tension through their neck, help manage their migraines. And so we're going to go through a list of different tools, devices that you can utilize at home, and we'll kind of explain how we recommend using them. And there's a big market for these types of things like massage tools and like trigger point release tools and things like that. And so we did some research and came up with a list of tools that we think are actually helpful, and we'll talk through them. So first off, just a basic tennis ball. So what can people do with a tennis ball?
Yeah, this is a nice one because a lot of people have it in their garage already. And you can just take a single tennis ball and you can put it actually on the wall, and then kind of, if you can think about like backing up into it, leaning your body, you can get these kind of upper shoulder, lower neck muscles where you kind of pin the area, kind of leaning into it. And then what's nice is, of course, you can just find a tight spot and hold, because muscle will respond after about 15-20 seconds. But you can also kind of pin a spot and then move your head in an opposite direction. So we call that pin and stretch, and we actually do that manually here. But you can, again, find that spot. So let's say it's like your right upper trap, and then you could kind of look down towards your left armpit. That'll kind of stretch the muscle and fascia under the pinning of it. And so that's a really nice way to use tennis balls. And another trick, we have an occiput device on here we'll talk about later, but a nice other trick too is you can get two tennis balls and just put them in like a tube sock, tie the tube sock off, and there are these two little nice areas that you can lay down on and press kind of right along the hairline to get an occiput release or suboccipital release. And that's another just cheap, easy way to do, some self things at home.
Yeah, that you all probably know what spot we're talking about, that painful, tender spot at the top of the neck, base of the skull, and usually it's irritated when you have a headache or a migraine, and you have that intuition of like, I just need to rub that spot. So the tennis balls can be helpful there. If you try that with the sock, lie on your back, kind of tuck your chin a little bit to try to gap that and expose that area that's going to be sore. Mm-hmm. Sometimes the tennis balls are not as like concentrated of pressure. But yeah, that can be a simple way. Probably, you have tennis balls in your garage or something. Grab those, grab a sock, try to release that. We call it the suboccipital area, where a lot of that tension comes from. Then we have lacrosse ball, kind of the same line of thinking here.
Exactly. I mean, lacrosse ball is just going to be harder, and so some people prefer this or already have this in their garage, instead of a tennis ball. And so honestly, same things. You can do a lot of pin and stretch with that, rolling on the wall. They're probably a little too big and hard, honestly, I would think, put them in a tube sock. I guess you could try it. If you try it at home, let us know how it goes. But yeah, kind of same way you would use a tennis ball. It's more of a matter of preference. The tennis ball will be a little more giving, where the lacrosse ball is going to be a little more deep tissue.
Yeah, and by the way, when the kind of idea behind pressure on a muscle is, so think of the muscle as in a sense like it's overworked. You've been asking it to do something that it wasn't necessarily designed to do or conditioned to do, and so it gets mad and it says, okay, well, I'm gonna just sort of ball up in these little fibers. So certain fibers of the muscle can just tighten up, and it'll restrict blood flow, and it'll actually like kind of artificially weaken the muscle, and it'll change the way your body has to function, and it kind of takes more energy to do the same movements. So there's a lot of negative things with having what are called these trigger points. But one of the things that helps is putting direct pressure on that trigger point. And so usually what you're looking for is a spot in the muscle that is a true trigger point, will like refer pain. So it'll send pain to somewhere else in your body. But just finding the sore sensitive spot is what you're looking to do. with the tennis ball or the lacrosse ball. And what that does is it places pressure on the muscle, and the muscle actually gets that pressure and it thinks like, okay, this is like a worse experience, and so I need to figure out how to get out of this, and it'll relax. And so as it relaxes, then that restores blood flow and can improve muscle function. And so that's kind of the idea behind using a tennis ball or a lacrosse ball. And that's a lot of, I mean, if you go to Massage Avenue, or even with some of what we do, that's what we're trying to accomplish.
Mm-hmm.
We get a similar effect with some bonus things when we do dry needling. So this is kind of a way to get a same sort of treatment approach that maybe we would do with dry needling, something like that.
Mm-hmm.
Yeah. Okay, then we have the Theracane.
Yeah, the Theracane is kind of like this shepherd hook looking thing that has a ball at the end, and it's a nice ergonomic design because it helps you, again, get to that spot like between the shoulder blades or at the upper trap without, overstraining your arms. And so you can kind of pin that spot, and it's the same thing we just talked about. You can, again, pin and hold and kind of let that muscle have enough time to relax under the pressure, or you can find that spot and then move the head so you actually get a stretch underneath it. The Theracane is nice because you can do this sitting, you can do it watching TV. A lot of my patients, say they have one next to their couch and they just take a few minutes at the end of the day to release some of that tension, and it can definitely be helpful.
Yeah, this is a really popular tool. So you've probably heard of it, but it's a great way to self stretch, self treat, upper trap, kind of the levator scapula, those sore spots.
Mm-hmm.
So yeah, very useful tool there. Similar to that is the Myotool, and we were just talking about some of the benefits of that.
Yeah, the Myotool is kind of like the Theracane, but its shape is a little different. It's more like this elongated U, and in the middle there's these two hard balls, and so it's actually more designed to actually go along either side of your spine, so you can kind of feel those like bony like spots along the spine. It's not on that spot, it's just to either side, and you can lay down and then your hands can lift the sides to kind of get this mobilization kind of through each vertebrae. So you can kind of mobilize, for 15 seconds and then shift it up one more vertebrae and kind of work all the way up the spine. This is actually a device, I took a class from the guy who developed this years ago, and so that's kind of how I got introduced to it. It's definitely not as popular as the Theracane, but it's I have it at home and I have used it. I do think it's helpful. It's not as ergonomically friendly as the Theracane for the upper trap and neck, so honestly for what we do, the Theracane might be a little better, but for just like general spinal mobilization, sometimes the Myotool can come in handy.
Yeah, absolutely. And don't overlook shoulder tension when trying to self-treat your headaches or migraines, because we see it all the time where we work on someone's shoulder and it'll refer in the same exact pattern as their headache. So you can have a headache that almost exclusively comes from your shoulder. And so focusing on these spots with either a Theracane or a Myotool can be very helpful. So with the lacrosse ball, tennis ball, Theracane, Myotool, we're really likely going to be focusing on like the upper trap, kind of the top part of the shoulder. Like if you're wearing a backpack where those straps run, we hear all the time that people, if they wear backpacks, they'll like trigger headache. So likely those muscles. There's trigger points through there. They're kind of weakened in a sense. They're not functioning the way they should, so you can work through them with this. Okay, foam roller. This is one of our favorites. We recommend this to nearly all of our patients because we find it to be helpful, but maybe not in the way that you think it's being used.
Yeah, the foam roller we recommend is the smooth one, not the one with a bunch of bumps on it. And then we always recommend like the long 36-inch one or 3 feet. Because we really need that full length in order to lay down our entire spine from tailbone to head. A lot of people say, oh yeah, I have a foam roller, but it's just that short, like 12-inch one. And that can be okay for a couple of things to do, but for true pec stretching and a couple other things, we really like the long 36-inch one.
Yeah, so traditionally foam rollers are going to be used, I guess what's commonly understood with a foam roller is that you're actually like rolling through the tissue and releasing sort of the knots within the tissue or those tight bands. But primarily what we use it for is restoring posture and getting the mid-back moving. And so we've talked about this. We have videos on this. So if you don't follow us on like Instagram or TikTok, like I would suggest you go to those because we have a lot of helpful videos. But yeah, it's a pec stretch and it's getting the upper back, mid-back moving. So we're in that forward sitting posture throughout the day. A foam roller can work wonders on getting us to extend backwards and allowing us to move in the opposite direction because most of our spines are just stuck in this sort of forward posture.
Mm-hmm. And one other thing with that is one place I like to use the foam roller outside of those two main areas is along the lat muscle. And this one can be a little bit tricky, so I would definitely recommend, like, if you are seeing any kind of PT or someone, like, asking them how best to do it, maybe YouTubing it, but really getting along the outer, the part of the shoulder blade and outer lat, and rolling on that spot, because sometimes that can actually help release the upper traps we just talked about, and it can also be a referral point all the way up into the head, so just something else you can use the foam roller with.
Yeah, the lat's a huge one. I mean, with my patients, I've been focusing a lot on the lat and the subscap, but it's just, you almost need something to kind of pin the area down as you stretch it out, so the foam roller can be useful with that. Mm-hmm. Okay, a hand towel is another one that we recommend often.
Oh yeah, this is a great one because everyone's got a kitchen towel lying around. I always recommend the thinner, honestly, kind of the better. Like those thick plush towels will not work as well. But if you just kind of have an old tea towel or something like that, this is really nice. We teach a couple of great simple neck exercises that really gets the joints moving and a little bit deeper stretch. That's something maybe also on our TikTok or Instagram you might be able to find. But yeah, hand towel can come in very handy.
So the idea here is, so if you think about these stretches that are often prescribed, given with physical therapists, or just, if you look it up on the internet, where you're like pulling your head down like towards your armpit, and then you like turn your nose to kind of pull it towards your armpit. Those are like upper trap stretches that they're not inherently bad, and they can be helpful for some people. But for the most part, in our patient population, we see it as you're kind of pulling primarily on the mid portion of the neck. And so we do want to provide a stretch to the shoulder, but that pulling sensation might not be such a good thing. And what I'm getting at is we want to be more specific with the stretch. And so the hand towel allows you to stretch in a way that is more specific. So we talk a lot about C1 and C2, the upper part of the neck. Using a towel helps assist with that. And then it can also help assist with sort of the suboccipital area, releasing that. So again, explore our social media pages and sort of dive into that. I know we've got the hand towel with rotation one on there. And that one can be a little tricky. We like to go through that with people on our virtual evaluations because it is a little tricky and it's hard to understand what should be happening. But for the sake of this conversation, a simple hand towel can be a useful tool if you know how to use it. So, all right, and then we've got occipital device. This is the occiput, right?
Yeah, exactly. Yeah. This one is like a very hard foam. I actually haven't seen this one in person. I just know one of my patients uses this and likes it. And you can lay down, again, very similar to like the tennis ball idea, but a little bit more obviously formed and easier it's flat on the bottom, so it can, stay on the ground very easily. And so you basically lay down on it, again, right along that suboccipital area, hairline, and it just helps kind of gap and open and then work on the suboccipital muscles there.
Yeah. So, and I misspoke, it's called the Oxy Pivot. I believe.
You're correct.
Yeah. And what it was, I think it was a physical therapist, and he would do this occipital release, which I'm sure a lot of you are familiar with if you've maybe gone to a massage therapist or a PT. It's a very common technique where you kind of push up into that sensitive area just below the base of the head and you pull back a little bit. And so what he did was he put his hands like that, and he just made a mold of foam, a stiff foam, so that people at home could kind of lay down and reproduce that same sensation. All right, and then we have Theragun, which is a very popular item.
Yeah, I think the original was like the Hypervolt that kind of got big.
Yeah.
We've worked with Bob and Brad a little bit about their Theragun. There's lots of different types out there now, but it's basically a massager that does like a very quick, rapid motion, kind of like a percussion essentially onto the muscle. This one is nice because it's almost vibration-like, because the speed can be so high, and we do know that like vibration and pain are on the same spinal tract to the brain, and if you can get vibration strong enough, you can almost override pain signals a little bit temporarily. And so of course this is just a nice like thing to do at home if you're in a lot of pain and you want to try to kind of override some of those pain signals more naturally. The Theragun could be a good option.
Yeah, and I feel like I get that sensation of like, there's just something about like body work and like a different sensation through muscle tissue, and that is sort of drowning out the pain signal, but it's also, I don't know, it gives you this sort of rush of endorphins that just feels good. And I feel like the Theragun is a useful tool in that regard. I wouldn't necessarily say that it's a tool that is providing anything outside of like maybe more of a short-term like relief, and but a very useful tool nonetheless. And I was actually using it the other day. There's an attachment. It's almost like it's filled with air, and it has a flatter end to it, so it's a little bit softer. And we were talking about how you could probably get away with using that at kind of the base of the neck, but for the most part, like that hard, the hard round tip is not gonna. It's just not gonna feel as good on the neck.
Right.
And you might want to stay away from that on the neck, but kind of through the pecs, like the front of the shoulder, around the shoulder blade, the upper trap. Those are all good spots to use a Theragun. And then people ask us all the time, like, you know, heat or ice. So we have heat pad, and then we have ice packs for the head and neck. So
Yeah, I mean, this sometimes is just a personal preference. Again, it's more of a short-term relief thing. In general, I tell people heating areas or heating pads generally can feel kind of better from those upper traps, shoulders down, whereas ice can feel better along that suboccipital ridge, like very upper neck and into the head. So there are a lot of devices out there that actually you can put in the freezer, and then they come onto your head like a big hat or something that kind of compresses you and gives you that ice, and can kind of override again those pain signals sometimes, and help with the pain. And I even tell people when they leave, if you have both and you want to try, you can try ice on the head and upper neck while you heat your shoulders at the same time. And sometimes it'll have this like drawing downward effect of the blood, and that can feel sometimes kind of nice.
Yeah, that's good.
Yeah.
And that the ice cap out there has a kind of a dual effect with the cooling sensation and then the pressure, similar to what Dr. Stoerzbach said about the Theragun, where that, you know, vibration can drown out pain, that deep pressure can drown out pain. We've talked about that before, like the pain sharp sensation can be drowned out, like if you just rub your head, like, you know, you bump your head, you intuitively rub it, same type of thing. Just pressure on an area can be helpful. And by the way, I was just thinking about this. We don't get paid by any people on here, so
no.
maybe we should.
We probably should have started with that. We do. We even have links on here. I don't know if we'll put all of them on the podcast area, but yeah, no. This is all of our own, like, kind of little research of what we use. But
there's no bias.
We don't. Yeah.
And we think that these types of tools, again, we're kind of like pro things that are outside of medication, because we feel like if you have headaches or migraines for any significant amount of time, like, you probably have been prescribed something, or you probably are aware that there's medication to help like mask symptoms and stuff like that. And so we're pro everything outside of that, because we feel that that area has probably been covered, and it's time for a new direction within the headache and migraine world. So that's all we're trying to do here. We're not trying to make a bunch of money by selling you guys products. So yeah, we've got acupressure device and then essential oils here. So yeah, what are some helpful things?
Well, yeah, the acupressure device is this point like right past your thumb and that kind of fleshy point between thumb and first or index finger. It's a common headache point for acupuncturists, but there are these little like clip-like things you can kind of put on, and it continuously puts pressure there. And some people really swear by it. It doesn't work for everybody, but sometimes it's worth trying whatever you can. So some people, really like those. You can even put one on and drive with it to work, kind of a thing. It's pretty easy. And then the last one is essential oils. We definitely know like peppermint and those kind of, what is the word? I almost want to say flavors. But yeah, aromas.
Yeah. Pick your flavor.
Can be really helpful sometimes with headache pain, and so also again, a nice easy thing to try at home.
Yeah, we have that deep blue rub that's good after like body work and stuff.
Yeah, doTERRA is definitely a good brand.
Yep. Okay, and then lastly, so this is something that I have been working on for about 5 years or so. So I actually had a patient who was a missionary, and I had a few sessions with her, and she was going overseas, and these migraines were a big barrier for her, and so she was looking for something to help mobilize her neck. So that's rotation with C1 and C2, getting nodding through the upper part of the neck. And so I came up with this device, went from idea to prototype, a couple prototypes, getting it manufactured, wrote a patent for it, got that approved, and like this week we will have all of the pieces in place to start assembling it and like get it boxed and start selling it, which is pretty big deal.
Yeah,
I'm excited about it. It's called the SAM device. So get SAM relief. The idea is if you're used to having your spouse or a significant other rub your neck when you get a migraine, say don't worry about it, I'll have Sam do it, right?
Yeah.
And so the idea here is that there's a couple sort of stoppers or knobs that will place pressure on the upper part of the neck, and then using like a head strap and some pulleys and rope, you'll be able to rotate and nod and actually mobilize the joints. The reason I'm able to patent this is because there's not a device on the market that focuses on mobility, restoring joint mobility. So there's a lot that has to do with like traction or soft tissue release, massage type devices, but this is more focusing on mobilization. And so what we're going to do is we're going to start rolling that out with people that we do virtual evaluations with or in-person patients. And so we won't have it like up on the website ready to order. So if you're listening to this and you're like, oh, I want to get one, it's probably going to be kind of a longer conversation with us. And then if you want to, if you're curious in that, give us a call, reach out to us, and we can walk you through that process. And if you're a good fit, we'd love to send that your way and see if that's helpful. The website will be Get Sam Relief, SAM. Right now, if you go to that, it'll just go to our Novera Headache Center page. But that is coming soon, and we feel like that'll be even more helpful than these other devices we listed, and a great way for patients to be able to treat their own neck without having to come see us, especially if you're out of state.
Yeah.
So there we go. There's the Headache Doctor podcast, and the episode. On this episode, we broke down all these different devices that you can try to self-treat at home. We appreciate all you listeners out there, and please stay tuned. Reach out to us if you have any feedback, topics that you want us to hit on. And as always, if you are happy with what we're doing, if you jive with our mission and want to see it continue, please write us a review so that our podcast will jump to the top when people are searching for headache, anything. And we would appreciate that. Thanks for listening.